All right, everybody. Thank you so much for your patience. We're going to get started in a minute or so. So I appreciate you guys coming and joining us and giving us time for from your busy Thursday. And I'm going to give instructions in Spanish, so bear with me. Para las personas que están entrando, gracias por su paciencia. Vamos a comenzar en algunos minutitos. Recuerden que la sesión de hoy va a ser completamente en inglés, pero mi compañero Juan va a estar haciendo la interpretación al español. Así es que en su pantalla hay un icono de un mundo o una bolita donde dice interpretación o traducción. Háganle clic ahí y van a poder escuchar la voz de mi compañero Juan dándoles a lo que estamos platicando en inglés. So, por favor, si no la ven en su pantalla, pueden hacerle clic en las tres bolitas que dice More o Más y les va a salir otro menú donde pueden encontrar el icono entonces para traducción e interpretación. So thank you so much for your patience as I'm giving instructions in Spanish for our Spanish speakers. So I think we're going to get started. I want to be conscious of your time. And thank you so much for being here today. My name is Berenice Pan. I'm a FACE manager with Chicago Public Schools. But like many of you guys, I'm also a parent. My munchkin is a student of Chicago Public Schools. So like many of you guys, we have tons of questions, right, and concerns. So the hope today is that we answer some of those questions that you guys have provided for us. So today we're here as the expert as part of the Family and Community Engagement and Education Office. Sorry, I'm trying to change the PowerPoint, but my computer seems to be frozen. Sorry, guys, bear with me. Okay, let me stop sharing and then reshare. I apologize, everyone. Technology, so sorry.
Yep, totally get it. Happens to everybody.
Right? Thank you, guys. Let me see. All right, it seems like I'm having technical difficulties, so we might do without a PowerPoint, so I apologize. But a couple of things before we get started. In today's session, we're gonna answer some of your questions. So just to let you guys know ahead of time, as you guys RSVP, you were also able to submit your questions. So we're gonna get started with those questions before we open the Q&A. So this time, unlike if you've joined us in previous sessions, we usually have the chat open. We're gonna have the Q&A open in this session. So make sure if you wanna ask a question that you do it in the Q&A, and you're gonna find that at the bottom of your screen. So instead of chat, click on Q&A so that we can see those questions. But just keep in mind that we might not get to those. If we don't, we are preparing the Q&A document for after the meeting. We'll usually send out an email and give you guys a couple of links that we share in the chat or that we are going to update for you guys, and we'll give you that information at a later date. Please be patient with us that if we're not able to answer today and we're trying to answer those questions, give us a few days since we might not be able to get through all of them by tomorrow. So please be patient. The other thing that we're going to do, we are recording this session. So make sure if your other parents in your community were not able to join, we're going to share our YouTube channel so that you guys can share the link with them and they're able to get the information that we're going to be sharing today. So thank you so much for that. And today our speaker is Chief Carson. And I had a presentation, so I'm going to let Chief Carson introduce himself and tell us a little bit about what he does. And I know, Chief, you also have a little presentation for us before we get started with the Q&A, right?
Yep, I sure do. Hi, everybody. Again, I'm Chief Clarence Carson. I'm here at CPS, of course, here in the central office still. You know, it's been a crazy time for us all, trying to make sure we're preparing our buildings for what we need to make sure that they're safe and secure for a reopening. We've been working quite hard now since March. I want to talk about that in my slide a little bit as well. Since March 16th, I think was our last day of school at that point to make sure our buildings are ready for reopening. It's been a steady pace for us all. And I assure you, we're working very hard to make sure everyone's going to be safe during their return.
Thank you, Chief, for that. And you do have a PowerPoint, right? So if you want to present your screen and put that up, fantastic.
Yeah.
And as our chief is pulling that up, just know once we're done with that short presentation, it's going to be a lot of information. So hopefully we'll put that in our brains. And then we're going to get started with questions that you guys have previously submitted through our SVP. Okay, Chief, I think we're ready.
Yep, hopefully everyone can see that. Hopefully
Yes.
everyone can see that clearly. Okay, perfect. So again, our focus is on reopening schools, fulfilling the department's vision of creating a safe and equitable learning environment. So first, I'd like to start out by just describing the facilities department itself, or CPS and then the facilities department itself, to make sure everyone knows the department I'm over and what we're about. So the facilities department is dedicated to providing CPS students with a clutter-free learning environment that is safe, warm, and dry. I know people hear that term a lot, but I get to say truly that the facilities department is the safe, is the warm, and is the dry. Our department's vision is to provide high quality and equitable learning environments across the entire district. And our mission itself is to make a student proud of their school so that every student can concentrate on their studies. Additionally, the department assists schools in the day-to-day physical operation of their buildings, striving to reduce the energy use of each school or providing a more comfortable classroom. You can imagine that's especially key right now. So a little bit more looking back at the entire district itself. Of course, we are the third largest school district in the country. Excuse me. We operate across Chicago's 77 neighborhoods. I know at some point soon to be 78, but right now it's 77. We have about 40,000 in staff here as a district and about 355,000 students, with about 76% of those students being economically disadvantaged. It's something I'm highly aware of, and as a district, we're highly aware of as well. Our student makeup, just for general conversation's sake, is about 35% African American, 4% Asian Pacific Islander, 46% Hispanic, 1.3% multiracial, and 0.3% Native American, and about 10% white, and the rest being more of indicated as NA. We have a 5-year record of high graduation rate as of last year at 82.5%. And, we have a pretty sizable budget, pre-COVID even, the fact that what we had to spend to make sure our budget, our district runs efficiently. But at the same time, we typically had a $1.8 billion deferred maintenance budget as well that we had to plan against every year, which is we do that with our capital planning as well as our facilities management department. So CPS's mission as a district. At CPS, our mission is to provide a high quality public education for every child in every neighborhood that prepares each for success in college, career, and civic life. And regarding our equity commitment as well, eliminate barriers to success and ensure equitable opportunities for all students. So again, looking at our department, right now we have about 471 elementary schools and 9 middle schools, 171 high schools, and 7 stadiums we also manage through our department. If you look to the right, it shows that we have from brand new buildings up to over 150 years old. Our average age of building is about 81 years old. So I just want to make sure to set that landscape out for everybody. So on the left, you see some of the scope of work that we do here: building repair, preventative maintenance, and custodial cleaning and disinfection, grounds maintenance, pest control, snow removal, and also applying these APA standards to our cleaning to make sure that we're cleaning and disinfecting to a high level. Now, in the middle, these are actually pre-COVID numbers, so I want to make sure to clarify that. It shows we have 835 board custodians, about 1,200 FTEs, privatized custodians, and also a pool of 575 more custodians in case we need them. And also another 515 privatized privatized building engineers, and about 100 building managers. As I'll talk about in my slide deck, we actually added another 400 custodians for our COVID-19 response as well, which will then be added to those numbers you see there now. So essentially we'd have about 2,400, almost 2,500 custodians full time, plus another 575 that will be added to us to supplement us as we need to in and out. To the far right, we have about 67 million square footage of building space as a district. So again, a really huge footprint here in Chicago. I think we're only second to the GSA in Illinois. So as I alluded to earlier, we actually had our first positive case on March 6th. You can imagine as a department, we were highly involved in that and being really responsive to that when that occurred. Our last day of school was March 16th. And since then, of course, our students have all been in remote learning. and child learning hubs ever since then. We had no summer programming for instruction. And then, of course, we had, we all lived through travel restrictions and so on. I know people hear this all the time, but we're going to hear this a lot more, I'm sure, with this more recent administration coming in office and DC, following and heeding the wisdom of science and following the science. That's really key for us here as well. We look at constantly our industry and agency partners, and also community input as well, and also the internal task force we have here at CPS. So we're talking about the CDC, WHO, ASHRAE, IDPH, and CDPH as well, truly following the science. I tell you, I read documents from Harvard so much, I should get a degree from there, honorary one at least. I don't want to pay for it, but honorary degree. But we're constantly researching information from there, all to make sure we have a safe return of our students and staff back into the classroom. So what I'm trying to show here, I won't read through all these slides, but I want to show here that the first step we did as a department is going through and developing a strategic targeted, developed a targeted strategic initiative team, or SIT. We focused on what we needed to buy to make sure we had enough of it, and that you can imagine the buying power of CPS is global, but at the same time, everyone was going for toilet paper and everything else as well, so we make sure we get our fair share, and we have to know it as soon as possible. We also had to key in on custodial and disinfection planning, which aligns directly with the CDC guidelines when it comes to our providing safe spaces for our students and staff. And of course, that looks at the EPA rated products. And a lot of people think they're buying products as well that are meeting this high bar that is being set for COVID-19, the virus itself, to make sure we're disinfecting properly, but to make sure that all these products are EPA rated and approved. And then of course, also our building engineering controls. Again, that's ventilation, filtration, and so on. They make sure they're all there. There's of course heavy reliance on following health guidances that are all there in place. As you see in the top right, we did a hazard assessment. A lot of that is looking at trying to understand the virus itself and how it works. That's looking at the paths of transmission. There's close contact, there's long range contact, and there's fomite transmission as well. A lot of these have evolved over time. I know we learned a lot more, of course, since March, but it's still understanding the virus itself and how we need to respond back to it. And again, from an engineering standpoint, you're looking at the idea of the hierarchy of controls. What can we control and how can we dictate a safe space in our buildings? Go from elimination to substitution, engineering controls, administrative controls. You see slight examples here in these pictures, PPE, and also community protective equipment as well. So we also looked at from this tri-hygienic approach, truly looking at hand hygiene, respiratory hygiene, and illness hygiene, putting it in these three major buckets. On the hand hygiene side, again, we prioritize hand washing, hand sanitizer dispensers, and also disinfectant wipes to make sure that any of our spaces that we're touching are being cleaned. Of course, also as a department, we revised our typical cleaning program to be an enhanced routine cleaning and disinfection program, which focused on high touch point areas and also increasing our frequency of cleaning. When it came to respiratory hygiene, you can see here we looked at, again, the transmission through respiratory pathogens and through airborne nature, which focused on providing plexiglass barriers that fix the interactions, densifying classrooms to having less people inside of them, and then also offering 1.2 million cloth face coverings and more to all our students and staff to make sure that they're covered and safe, as well as other layers of mitigation in that area as well. And then also providing the air purifiers localized in those spaces outside of, in addition to and supplement to our mechanical ventilation systems in our buildings, as well as our localized ventilation through our windows. And then also looking at illness hygiene, again, number one, if you're sick, stay home. You can't say that enough. We also put in place a daily health screener to make sure everyone's reminded of this and go through the symptoms, if you should stay home or not, if you traveled or either to other states or other countries or so on as well, to make sure that you understand that some spaces have higher positivity rates than others. Then also looking at 1.5 million signs and posters. Again, 1.5 million signs were put up around the entire district, some of which you see in these pictures, to identify anything from social distancing to washing your hands, using sanitizer, path of travel, and so on. And again, we push for every space to have at least 2 care rooms in them to isolate symptomatic students as well. something we worked really hard at. You see some of the other signs on the left side. So I think this is a really important slide. I want to make sure everyone focuses on this, and I'm sure it's going to help us out when we get to our question and answer section. Again, respiratory, focusing on that a little bit more. I'm taking this directly from the CDC guidances that we have to show that we're directly in line with that. And I even gave you the date. The most recent report was they put out. Again, a lot of guidances are out there, but this is the most recent one was dated 12/21/2020. I'm sorry, 2020, not 21. So the CDC recommends a layered strategy to reduce exposures to SARS-CoV-2, otherwise known as COVID-19. This includes multiple mitigation strategies of several layers of safeguards to reduce the spread of the disease and lower the risk of exposure. If you look down, right beneath that, talks about the list of ventilation interventions that can help reduce the concentration of the virus particles in the air. They represent a list of tools in the mitigation toolbox. Again, it's a mix that you have to apply because every building is not the same, every space is not the same, each of which can be effective on their own. Implementing multiple tools at the same time is consistent with CDC mitigation strategies and increases overall effectiveness. So what I wanted to show here real quick, as quick as I can, is just showing you these are exactly from the CDC, and these are things that we put in place. So we increase outdoor air ventilation using caution in highly polluted areas, check. Increase fresh outdoor air by opening windows at least 2 inches. That's really all you need to have is at least one window in a space open 2 inches, check. We decrease occupancy in areas, check, by de-densifying the classrooms. That's how we went about that. Increasing ventilation systems to operate properly. We did a ventilation assessment, which again, it's even beyond what ASHRAE even asked for, and other districts have even done. We went through and assessed every one of our buildings to make sure they're working properly, and then invested at least $75 million since COVID-19 started in repairs to our buildings to make sure they're up to date and they're going to be actively usable and the way we want to be to meet the challenges of the day. Provide acceptable indoor air quality for the current occupancy levels for each space. We performed the indoor air quality assessment. Again, this is beyond what most other places are even doing around the country. We brought in outside experts to evaluate every one of our schools to make sure the indoor air quality in temperature, humidity, particulates, and CO were at acceptable levels, and all of them are passing. Open outdoor air dampers beyond minimum settings to reduce and eliminate HVAC air recirculation, doing that as well, and improve central air filtration by increasing air filtration to as high as possible without significantly reducing design airflow. Check, doing that as well. And the last two is showing here, ensure restroom exhaust fans are functional, check. And lastly, consider portable high efficiency or Hepa fan filtration systems to enhance air cleaning. We spent over $8.5 million providing these air purifiers in all spaces as well. So again, for ventilation, we're meeting all their needs. And the last thing I'll say on this, I won't spend a lot of time on this. Again, the fomite itself is actually the surface area being cleaned. The fomite places we touch. So we talked about transmission being respiratory, but also fomite being in the areas and surfaces that we're touching. We had an effort aimed at limiting the survival of the virus and key elements and significantly disrupting it through fomite transmission. So not only do we just push on disrupting it, but we also spent a lot of money to make sure we had paper towels, hand soap, hand sanitizer, and disinfectant wipes in all spaces. We onboarded 400 additional custodians equitably across the district for this purpose as well, to make sure that schools that needed more got more. And then we were training on PPE and how new COVID-19 measures, including new equipment, using hospital-grade disinfectant spray misters in spaces, and also EPA listed and approved products in our schools to turn over spaces even faster, make it even more safe. And again, I already explained to you all earlier, the enhanced routine cleaning disinfection program we put in place, again, focusing on more frequency and more high-touch areas, and then also just kind of making a differentiation, doing seasonal deep cleaning as well, what we do then. And then lastly, in partnership, in each of these above cleaning programs, it requires the coordination and partnership between the school leadership, school staff, Office of Student Health and Wellness, and also the facilities department to make sure we're all successful. And the last thing I just show here again, there's just more of a continuation about how if you look at the grid on the right, we truly use engineering and science to figure out how the desks should be set up as well to make sure we're not impeding on the 6 foot distancing, to make sure we're counting how many occupants should be in each space. We use a tool for that, and we use that for all these methodologies. So other than that, on the left, just highlighting the fact that we're meeting ASHRAE guidances for all of these different means. On that, thank you all very much.
Thank you, Chief. I appreciate it. That's a lot of information, like you said. So we're going to take a few minutes to digest all the information you gave us. And again, to the participants that are with us today, we're going to get started with questions that you submitted previously. So during your RSVP, we asked if you had any questions, and those are the ones we're going to be using to get us started. If we have a few minutes, we're going to then go into the Q&A to try to answer some of those questions as well. But just keep in mind, we might not be able to get to those tonight. Okay, so thank you again, Chief. So we're going to get started with some of the questions they send. I have a community person, Sharon, who asks, how often will high-touch surfaces be cleaned or disinfected, and who and how often will air filters be cleaned?
So I'll start with the air filter side.
Mm-hmm.
So, we follow manufacturer recommendations on the air filter changes and clean. I mean, they'll be cleaned daily itself, but their replacement will be by manufacturer guidelines, and that'll be driven through the building engineers to do that replacement when they need to be replaced. I think typically it's for this size and grade, it's talking about the building itself. I think it's like every 6 months or so, but we're pushing for that even sooner to make sure we're checking them, to make sure they're actively meeting specifications of quality. And the same thing applies to the air purifier units in the classrooms as well, following manufacturer recommendations, but at the same time checking on them often to make sure they are, meet our standard of quality. As it pertains to the frequency of cleaning high touch areas, that's every day, right? So our custodians are cleaning outside of the classroom. Well, I say even before people even come in the building, they're cleaning in the morning, and then during the day they're cleaning all day. And then when classes are over with, they're going to go into the classroom and turn that classroom over as well. With cleaning and disinfection is both. So it's not just cleaning the spaces, but it's also disinfecting them as well daily.
Thank you, Chip. And I think that's good that you did that clarification. It's not just cleaning, right, and the wiping, but also disinfecting the area. Thank you so much for that. We have another question from one of our parents, Ms. Maldonado from Reese Elementary. And she's talking about the hybrid, right, the A and B, and that Wednesday not having class. So will Wednesday be a day of just cleaning and disinfecting the classroom when students are not there?
Yep. So, so one thing, though that is a hybrid model, we also recognize the fact that cluster students and pre-K students are there 5 days a week. So yes, some are in hybrid model, some are there 5 days a week. That actually is an area that actually has to get updated. And I know I've been talking about it internally here for, maybe the past week or so, that the idea of using Wednesday as a deep cleaning, I think is misleading, because we're actually doing that level of cleaning every day. At one point when that Wednesday was wide open and no one was in the building, there was a thought that was going to be needed to turn over the building that way. But because we've increased our staffing, we created a whole new model of cleaning disinfection. We're actually doing that every day now, not just on this idea of Wednesday, of course. So what we do every day is what we're doing also on Wednesday.
Got it. Thank you so much for clarifying that. I think you're right. We think like there's no one in the building, so that's when they're going to power clean everything. So thank you for letting us know that's something that's happening every day. We have another question from one of our community members, Rose from Community Builders. How are CPS facilities being updated and made safe for our youth and staff?
So that's a great question. Again, since March, you can imagine we've gone through a lot of evolutions of what safe means and what ready means. At one point, of course, it was just signage and maybe just temperature taking. Then it turned from temperature taking to having a health screener as well. Make sure that at the entryway of the buildings, that we're creating a line of protection around the buildings and those occupants. Make sure that whoever comes into that space understand that they needed to be, need to have COVID-free or illness-free before they even come inside. And then once they're inside, make sure that we have all our cleaning program ready. So I said earlier that we invested a lot of money in this to make sure that we have students and staff coming back to the building safe, that can remain throughout the day. Again, that's upgrading our ventilation systems where they may not have been great at one point, school by school, system by system. If you go to cps.edu/air quality, you'll be able to see where we're at right now when it comes to our ventilation systems, from the ventilation assessment, as well as the indoor air quality assessment that was performed as well. Again, that was huge to truly understand, again, where we're at as a district, room by room, not just building by building or by network, room by room within the building, and saying, are we ready or not for students and staff to come back? And then assessing those, and then investing the money in those areas. Thank you, Adrian, for providing that, to make sure that we're then repairing those in real time and not just in a program in the by and by. So that's a real huge one. And also making sure that, if our cleaning products, before we're good, are they good enough for COVID-19, for that level of disinfection? You can imagine the EPA was also at a learning curve on what products are best use in this instance. So we made sure to review our products and revise them and revamp them if necessary. At the same time, there are certain products that typically, not just the facilities department, but a school district itself did not have to invest in before. Face shields, face coverings. I know there's a migration even that it was face masks, there's really face coverings. Are they PPE or not? And that whole understanding of what that is as well. The sanitizer, to this extent, we're buying it now. And all these areas are evolution of where we were before. And we've made the adjustments, which is really important. There are some districts that are behind us, and not to discredit them at all. Everyone's learning at their own pace, but everyone's learning through this. We used to say lessons learned. We don't say that anymore. We say emerging lessons, because it's a new lesson every day. And I can imagine, again, I say this, I kind of alluded to it earlier. I can imagine with the new administration in DC, we're going to learn even more, that we're going to, be responding to promptly to that as well. And we're learning through it together, and we want to be safe as we do it.
Thank you, Chief. No, thank you so much for clarifying that. And I think on that same note, we have a question from a parent, Sarah from Von Linné Elementary. You talked a little bit about ventilation, and she wants to know, what are we doing about those rooms that don't have windows?
Yep. So there are spaces that don't have windows, and if you look on the ventilation assessment, you'll see those spaces called out with an indicator. But you also see those spaces have mechanical ventilation. So again, that layered mitigation strategy I talked about earlier in my presentation is not all of everything. It's a layered mix of strategy for each building, because each building is designed differently and designed in a different time period as well, how it functions. So we have spaces that have mechanical ventilation, but may not have windows. We have spaces that have windows, but may not have mechanical ventilation. And you have other spaces that have a mix of both too as well. Again, if it does not have windows but has mechanical ventilation, it's fine. Our buildings are designed, in either situation, our buildings are designed for having a certain amount of airflow in them. If it was natural ventilation through the window, they're still calculating that as well, and our buildings are designed for that too. So City of Chicago code requires us for a minimum of 5 air exchanges per hour. Again, City of Chicago code requires us for a minimum of 5 air exchanges per hour. And just so happened that ASHRAE, the leader, the nation's leader, the world's leader in ventilation and filtration studies, and also the CDC also recommended 5 air exchanges per hour to make sure that we're safe. So our buildings are required to meet that by City of Chicago code, and just happen to also meet the CDC and ASHRAE guidances. So, our buildings are in good shape.
Got it. Thank you, Chief, for making that clarification. We do have, in that same note, we have a question from Ms. Falcone from Burbank Elementary. She's a teacher, and we're talking about windows. So she has windows that don't open. She stated 6 inches, more than 6 inches. Will there be someone that will come and open her window? How would that work at the school level?
And I wanted to apologize to you. You might see me moving around quite a bit. I do not have ants in my shoes or anything. I've just been sitting, you're processing so much information is sitting quite a bit of time. So I tend to try to move around a little bit to kind of make sure
no worries.
that my body is still alive. So when it pertains to the windows, you only need your window. You only need one window itself to be open at least 2 inches. So I know one of the parts of people's questions are, typically, so do you want to freeze out everyone in the space? Do all the windows need to be wide open? That's not the case. You need one window in a space to be at least 2 inches open. So in your question, you're asking about 6 inches. You're fine. You can limit it by 2/3.
Got it. Okay, thank you so much, Chief, for that clarification. Because you're right. I think a lot of us were thinking all the windows have to be open extremely wide to get that airflow going. So thank you so much for that clarification. We also have a question from a parent, Sarah Lopez from Bell Elementary, and wants to know what are the cleaning protocols for carpeting, if there's carpeting in the classroom.
So the carpeting and rugs quite typically aligns with like pre-K and kindergarten. Well, more so pre-K than anything else. In those spaces, we are vacuuming, and that aligns directly with CDC guidances. So if you have a full day pre-K, we are vacuuming that, and that's how those systems, again, those whatever particulars might be there, are being pulled up by that vacuum. In the half day scenario, the schools are actually removing those carpets or rugs in those spaces because that switch over between the morning and then the next pre-K half day class being so swift. Yes, we're going in there, we're cleaning in between that, but we're cutting out that vacuuming time. So we just pulled out those rugs in those spaces.
Got it. Thank you so much. I think, yeah, the parents from the little ones, right, are really concerned because we're used to seeing that in the classroom. So thank you so much for that. We do have another question from Ms. Jonas. Sorry if I mispronounce names, guys. I apologize. From Franklin Elementary, who says, who will be cleaning the students' desks after they're eating, the sinks in the classroom if there's sinks, the manipulatives, napping cots, chairs, etc. Will the teachers be pulling up the chairs on top of the table so like at the end of the day, so the floors will be clean?
Yep. So I'll start with the back side of that and work back forward. So the teachers won't have to do that. The custodial staff will make sure that the spaces are being, cleaned every day, and they'll be the ones managing the furniture and the assets to make sure those spaces are being properly cleaned and disinfected. As it pertains to the tabletops and the chairs and so on in the active day of the class day, while again the classes are in their pods. That's why we provided the sanitizer locally in stations inside the classrooms, as well as the millions of wipes that we provide in every classroom as well, that give a certain level of empowerment to the teacher, but also the students to be able to control their space. So after they have lunch, they can wipe down their space as well. After they enter the classroom, or not to say they have to do when they enter the classroom because it's already clean and disinfected, but at any point, they can control that at their own time and their own pace. So that's what those wipes are there. As it pertains to cots and so on, the teachers will be cleaning or disinfecting those cots, as well as those toys, those combining cots and toys.
Yeah.
The toys for little ones, if they're putting them in their mouths or so on,
Right.
we're using a food grade disinfectant for cleaning those specifically because they may go in kids' mouths and so on for the little kids, and also for those cots as well.
Got it. Thank you so much, Chief. And there was an extra question that I forgot to read. There is, we talked about air filtration. The question is, will there be air filtration in the bathrooms when the kids are going into that bathroom?
So by City of Chicago code, the bathrooms are required to have an exhaust, not a supply. And you can imagine the point is not to recirculate the air in those spaces. So to have a filter, a purifier in those spaces is not what the City of Chicago code wants, nor CDC or anyone else wants that as well. If you can recall back, one of the first things we did, again, things evolve. So one of the first lessons we learned for COVID-19 was reducing the recirculation of air. So we actually de-energized the hand dryers and hair dryers that might have been in the spaces as well. That's one of the first steps we've done. If you all travel to spaces in any kind of commercial bathroom now, where they used to have the little hand dryer you stick your hands into and it created all this air, those have been shut down or removed from most of those spaces. And then paper towel dispensers have been replacing them instead. Same philosophy goes for putting a purifier inside of a bathroom. We had the exhaust there for that, and also localized windows in a lot of the bathrooms as well.
Thank you, Chief. I appreciate that. We do have a question from a parent, Jamila. Sorry if I mispronounced her name again. She did not identify a school, but it's a question about, is every school receiving plexiglass dividers?
So that's one where, that's an interesting one, because, so the answer is yes, but I know there's, again, some personal prerogative for some families who are making some choices that maybe that didn't involve the school. So we're providing plexiglass barriers at, as I said before in my presentation, interaction spaces. So that's the security guard desk when you first come in, or high traffic areas. So the security guard desk when you first come in, the main office, and also the point of sale area in the cafeterias. I do realize that some schools have made some other investments, and I guess that's a school-based decision they're making. But I will say that the main areas that are necessary for plexiglass barriers are only at these spaces. I will say this though, as it pertains to desk shields, as sometimes seen as a plexiglass barrier, understand that the CDC does not point at desk shields as a solution. It talks about social distancing, talks about mask wearing, hand washing, and so on. Those are the part of the 5 key drivers they're pushing to make sure people are safe, and it does not include a desk shield. And again, keep in mind, students sit behind their desk. They don't sit on their desk, and the desk shield is on the desk and does not really create any other support on the sides. So again, as a solution, that is not something that we're pushing as a district. We're pushing solutions that we think that are practical and truly will help with the help stop the transmission of the virus itself, just as the CDC points to.
Thank you, Chief, for clarifying. And that was actually the next question. I think you alluded a little bit on that, on creating those shields for the desk. And also the question was for this, if they're going to the cafeteria, right, are there going to be shields separating those kiddos from one another?
So in the so keep in mind, a good majority of our students will be eating in the classroom. There may be some instance where they go in the cafeteria for some other purpose, but even then they'll be socially distant when even doing that. But the plexiglass barriers are primarily at, the ones that we're providing are at the primary points of, concern, I guess, of interaction or high interaction, which are the main office, security desk, and the point of sale in the cafeteria.
And when you mean the point of sale, that's where they're serving the food.
Correct.
Okay, got it. I want to clarify that for some parents. Yeah. Thank you, Chief, for that. And staying in a little bit with about air purifiers, we have Lynn from Mark Shields Math and Science Academy. And the question is, how big are the Hepa air purifiers? The ones I guess she's seen on TV, in the news or in ads say that they're not big enough for CPS classrooms?
So this is a question where I wish the participation here was every family and every staffer that we have, to make sure that we're all saying the exact same thing. The air purifiers are a supplement to our mechanical systems. Again, our primary is our mechanical ventilation system. And along with that is our natural ventilation through the windows. And a supplement to those are the air purifiers. So if you look at the mechanical ventilation itself, they provide a minimum of 5 air exchanges per hour. That means that air in those spaces are breathing in and out at least 5 times per hour, at minimum. The windows are giving you more of that locally inside of those spaces. So now you're getting fresh air mixed within that space locally, again, in a high frequency as well. Then the air purifiers, based on the setting you put them on, provide at least another 2 air exchanges per hour in addition to that. So keep in mind, the CDC and ASHRAE point to 5. We're saying we provide a minimum of 5 with your mechanical systems, in addition to your windows being more on top of that as well, locally to those spaces, and also the air purifiers as well. So, it is providing the air purifiers is in direct alignment with the CDC and ASHRAE guidances and ASHRAE, ASH, RAE guidances, but it's not everything. It's not everything. It's not the engine running our buildings to make sure that they're safe. It's only a supplement to that.
Got it. And I think, thank you for clarifying that. So now we get a picture of it's like what's inside the walls that is making those 5 right passes. And then you have your windows, and then you have this extra machinery, which are the air purifiers that are in the room. So I think that's a good visual for parents to see of all the mechanics that are going to be working in the classroom. Because sometimes I think it's hard for us to understand what's happening when we haven't been in a classroom. We don't know what's in the walls. And so thank you so much for clarifying that. Appreciate it.
I just want to clarify with that one again. I know that, again, this question's come up very often. We're all concerned, you know, for our children, for their safety, of course. And then we see what we think is the fix. There's one thing that we can see and put our hands on that is inside of the classroom. But there's a lot more to this building that's seen beyond this one unit. And our buildings have been breathing in and out for us for a long time. And I'll say that our buildings are quite honestly more safe than, and the folks we put into them, more than any other commercial space you're going to walk into anywhere because of how much focus we put into this. So I want to make sure to clarify that as well.
Thank you, Chief. No, I appreciate that. We have one of our parents, Mark from Suter Montessori Magnet School, gave us a couple questions. So I'm going to read through some of this, so bear with me, everyone. He says, I was happy to hear that the City Council Committee on Educational meetings last week that all CPS classrooms are designed to meet the ASHRAE 62.1 standard of 4 to 6 air exchanges, as you were mentioning, per hour. Can you please provide the testing data for the classrooms that are open and will soon open, confirming air exchange are meeting the design specifications? Is that something we share?
Yep. So the easy way to answer that, I know it's a lot of engineering jargon and so on in there, which is fine. But to break it down for everyone else who's here, of course, it's how to verify our buildings are meeting what they need to meet to make sure everyone's safe. One, the city requires us to do that. We're not in violation of the city. Our city building code requires us to meet this amount, and our buildings are functioning. And what we did on 2 sides of that, not only did we make sure they're functioning with our ventilation assessment, actually going to every building, every space to make sure that the buildings are operating well, we also did the indoor air quality test. And I want to make sure everyone understands what that means. The indoor air quality test itself was not just a test of the air quality inside those spaces, but it was also a check on the ventilation systems to make sure they're working properly. If those filters aren't catching things they need to catch, then we'll have a spike in numbers for whatever the particulates would have come out to, as well as the CO levels in those spaces as well. So because, again, this is third-party, engineer licensed, practitioner came into those spaces and validated them as working properly, our building's breathing and filtering well. And that's a check on ourselves to make sure that our buildings are ready for reopening.
And that's what you mentioned, right? That they can see on the website that Adrian put up. Got it. So if you guys go to that website, make sure that you guys are looking at that. Okay.
And please spread that around to everyone else as well, that we have that website there. To revisit it, you can see our guidance is there too, but you can see your school and see the spaces.
Sounds good. Thank you so much, Chief. The other question that Mark had was, given the acknowledged dependency on the multi-layer that we talked about cleaning, right? In our schools, we have all these multi-layer things happening on the school. What extra steps have been taken for situations where one of those layers is missing? And he's talking about, so let me reread that again, pardon me. Given the acknowledged dependency on the multi-layer mitigation method of CPS reopening plan, what extra steps have been taken for situations where one layer is missing, such as confined areas where children will be eating, or those pre-K rooms where they will be on mask when they're taking a nap?
Gotcha. Yeah, so thank you for that. So again, it seemed like this person actually saw my slides already, which is great. The layered approach, and they're getting the idea exactly right from the CDC, which is fantastic. As you can see, we're doing multiple things in multiple scenarios. The disinfection, the disinfectant and cleaning we're doing at the cots where the students are at, as well as the air purifier devices in those same spaces, utilizing windows where they're present, utilizing mechanical systems where it's present, utilizing both where they're both present. We're taking a lot of different approaches to this. every one of our buildings, again, I showed you earlier on, that our buildings go from brand new, outside like Inglewood STEM, to buildings that are over 150 years old. There is no cookie cutter approach to how we can do this. And a lot of people say, well, just do this for all of them. That's not how this works. It's a different approach. So I can assure you, each building does something different. And hopefully my slides earlier help kind of allude to each one of those. I want to make sure not to use too much time with all my talking.
Sure, no worries. And for folks that are in the call today, we have your email, so we'll be sending out that deck so that you have it and you can read it at your leisure, so that you can have that information. Thank you, Chief, for that. I think we're still have a few minutes, so we're going to go through some of the Q&A that some of our folks have posted. So we have Eddie Smith, who says one of his question is, who's inspecting the schools regularly? So who's the one that's doing that?
Yep. So we have different levels. So with my department itself, I know at one point I showed at the top of my slide all the different departments. I have operations, I have energy and sustainability, I have energy, environmental health and safety, I have project controls, and so on. Within a department, if I just name two of those layers that are verifying this, outside of the building manager themselves, we also have a quality assurance team. So the quality assurance team goes through and actually audit every school for multiple different layers. So you can imagine right now they're auditing it. The audit has been reconfigured as evolved over time for COVID-19. We're looking at supplies, products on hand, where these products are in the soap dispenser. Are they filled or not? Are they constantly being filled? Do we have enough disinfectant on site? Are the spaces clean? Where the custodians are, where the engineers are, or where we're at in our filter life cycle of replacement. All these different variables the quality assurance staff is doing, and I have a large staff who's doing that as well. In addition to that, I have the environmental health and safety team who also works for me too. They're also doing the assessments of indoor air quality and any other hazards that may be in place. So they are doing these assessments all the time at our schools. Both of them are, and being responsive if an issue comes up. They are the teams that jump into that as well. And in addition to the building manager, the building engineer, the senior building managers, and so on, the custodians that are localized at the schools, all of them are responding as well.
Got it. Thank you, Chief. We do have a question. Sorry if I butcher your name. Reman, I'm sorry. Talking about Chromebooks, I think the question is who's going to be cleaning those Chromebooks. I don't know if the question is, are kids bringing the Chromebooks and they're taking them home? I don't know if that's a question you can answer about cleaning those Chromebooks.
So the cleaning of the Chromebooks is localized. So again, we have the wipes in the classroom as necessary, if they feel it's necessary in the classroom space. But again, the students are bringing these back and forth from home. So I assume that they'd also be cleaning them just like they would their own book bag or anything else as well, because it's in their use, it's in their hands all day. It's now a personal item for them to bring to and from school.
Got it. Thank you for clarifying that. And I think what I would suggest for parents, if they have questions, contact that local school and talk to administration, and they can give you a little bit more guidance. We have Nicole who has a question about air purifying. Where air purifying supplies for non-student areas like staff lounges where the staff spends time without masks, or copy rooms, etc. So are we going to have those air purifiers supplied?
So we're looking at all spaces that have your air purifiers if necessary. So if it's a compacted or conflicted space, they'll have air purifiers as well. Right now, we're focusing on providing air purifiers in larger communal spaces, that being the main office, and that being the classrooms, and also the care room, which is also a really important space as well, because we can understand those are for students that may feel ill or so on going in those spaces.
Perfect. Thank you so much. I do have a question in Spanish. I'm going to read it in Spanish and then I'll translate it for you. We have a parent, Leonor, that says, ¿Qué pasa con las escuelas que no están listas o no se les ha dado todo lo necesario que podemos hacer? So the question of this mom is, what happens to the schools that are not ready or that are saying they don't have all the necessary equipment to be ready for reopening?
So I can clarify this. Every school right now has all the PPE they were due to receive. That's one. I'm going to clarify that. That's all been delivered. Two, all of the disinfectant wipes have all been delivered as well. All the plexiglass barriers have all been delivered as well, and all installed too. All the signs have been installed. All the temperature thermometers have been installed, provided. All the face coverings have been provided already as well. That's the cloth face coverings for every student and staff. Multiple of them are provided. as well as disposable masks in the main office if someone comes to school and their face covering, is soiled or gets soiled throughout the day. Obviously, just on that face covering side, I mean, we're all living in shitty Chicago. We all are required to wear them. So not only we provided them to you as an equitable purpose as well to make sure to help with that area, even though we recognize that everyone should have their own already. And when it comes to any other supplies, I mean, the air purifiers are being delivered as well right now. I mean, the ones for wave 1 are already been in place before they returned. And wave 2 is coming up for teachers to return on Monday. And those units will be completely 100% done by this Friday as well, into maybe Saturday, it all depends, but still ahead of teachers coming back on Monday and students coming back on the 1st. And that's really the last item that we had to provide to make sure that, of the allotment, we're providing all the face shields for the ODLSS staff and everything else have all been provided already as well. So we made great pace and great achievements. You can imagine still in a very short amount of time as information keeps evolving. And I know and I want to make you clarify this major point. When we go to the store right now, we may not see products on the shelves. We may be only able to buy one canister of Lysol only recently because it wasn't there before. And at one point, toilet paper was very limited. But that doesn't mean we were that way. I know in some of my slides, you might have seen an array of boxes in our warehouse. Those are all our supplies. We've been ordering them from around the globe now for a long time, being prepared for this. And we were prepared, back when it was in the fall, and we're prepared now. So we have ample supply on hand and more to resupplement those when necessary.
Thank you, Chief, for clarifying that. We have one question from Maria Custodial, and I think it's about the restrooms once again. So will extra procedures be used to take for restrooms hygiene purposes? Is there anything extra? I know you mentioned some of the stuff with the not air purifiers for the exhaust. Yep. So if you can just kind of reiterate that, I think parents are still concerned with that.
Yep. So one, you can imagine they'd be really, again, I'm not in teaching and learning, but at the same time, I know that we put up signage all near the bathrooms, make sure the students are socially distant on those certain markers outside the bathrooms. Excuse me. The same thing applies to inside the bathrooms as well. We actually close down certain stalls and certain sinks to make sure they were providing proper distancing. So we close down a sink, we may have closed down a urinal, closed down a toilet stall, or so on as well, to make sure that there's space, and also provided signage and other wrappings around fixtures if necessary to make sure they're not used. Make sure the soap is in ample supply, as well as sanitizer outside of those spaces as well, just in case something else gets touched or some other concern that's happening too. And also the water fountains. The same thing applies to the water fountains. If there are two fountains next to each other, we are shutting down the one nearest to it if they don't allow the proper distancing, as well as putting signage up to say that won't be in use. And in one of the pictures hopefully I showed, I believe I did, we actually retrofitted all of our water fountains as well. So you don't have to push the push plate anymore. That you actually can use a bottle filler instead, actually, touchless. So now you put your bottle up to it, and now you can just refill it that way as well. So we made a lot of strides, thought about the little things as well as the bigger things to make sure that it's more touch-free as you come into the spaces.
Thank you, Chief, for clarifying. I think that was a concern of parents, right? What we are used to seeing as a typical bathroom with all the stalls open, all the sinks. There was questions also about when kids go to drink water. So thank you for clarifying. Some of those things are going to be shut down so that kids keep that distance. And with the water especially, now they can bring their water bottle and not touch anything, just put it in there and it magically comes up and fills your bottle of water. So thank you so much, Chief, for that. We just have a few minutes left, so I want to be conscious of the time. Again, to our participants, sorry that we didn't get through all the questions. I know you put tons of stuff in the Q&A. We will try to answer those as much as we can and then send them out to you guys, but please be patient. We're not going to be able to get to them tomorrow, so just be patient as we answer those and send them out to you guys. You will get an email from one of us tomorrow, just with links that we share with you guys today and the deck. But Chief, you gave us a lot of information, a lot of good information, a lot of numbers, a lot of acronyms for us to learn. If there's three things that you think parents should leave with today, that these are like the main things you want them to leave with today, what would those three major points be?
Man, the biggest thing I would say is that we're ready. I know that's really hard for people to understand and really believe. and all the precautions that we're putting in place, they are there and they are present. I know that people are getting a lot of external um, um, information, I guess, information from all these different sources that may be leading them to believe that there's a certain lack of readiness, that we don't have these products, that we're not actively ready. We are. And one thing I'll say is that I don't think people understood as much as they do now the emphasis on facilities and how we need to be trained, we need to be cleaning with disinfection and so on as well, and how we're really integral to the safe, the warm, and the dry. And I think people are really now having to understand that, but also have their levels of concern. And I get that. I'm a parent too. I have a daughter who's 9 that goes to a school here in the district, and she's ever so curious and asks me a ton of questions, and I love it because you can imagine I ask a lot of questions too. And I have a little son that's 3. My daughter's been in remote learning this whole time, and my son, he's been in daycare this entire time. So daycare has done it safely. We've put our son back, in the entire time. And we plan on having our daughter go back to school as well. I'm putting my family where my work is. And we believe in it. We believe it's going to be safe. So hopefully you all do too. I know it's a lot of chatter out there. Hopefully this will give you all a chance to hear from me directly, the Chief Facilities Officer of CPS. Wear your masks, be safe, stay distant, use our signs that are there, use the screener every day as you bring your student in, or if you're a staff coming back as well. We're working to make sure the buildings are safe, and they're safe today. And I know I got 3 minutes left. I know some people are, staging, staging, I guess is the way I can say it, outside of our buildings. And I get it. Again, there's a certain amount of concern and fear that is there and present. But our buildings are safe. And I work in the break fix scenario. If something's broken, we always look to address it, even more than we've ever done before. Hopefully you all give us a chance to show you all that. And hopefully we see you all back in school soon.
Thank you, Chief. Appreciate that. And thank you for sharing that your munchkin goes to public school and you're planning to sending them back in. So thank you so much for parents who join us today, giving us, I know it's been a crazy week with everything that's happening in the world. So I appreciate the time. Chief, thank you so much for giving us your time as well and your expertise and for answering parents' questions and concerns. We will send an email out with the deck and try to answer as many questions as possible from the Q&A that we didn't get to today. So I apologize again for that. But thank you so much, everybody, for joining us. And join us next week where we're going to have Dr. Jones from ODLSS. So you can ask her your question, make sure you RSVP and give us your questions ahead of time. So thank you so much, everybody. Thank you, Chief.
If I could say one last thing, thank
Sure.
you all who came again to seek out direct information. I think that's the best way to do it. Ask the questions, hear the answers, and hopefully you all weigh them in your decision making.
Thank you, Chief. Thank you for that. Thank you, everybody, and have a great night. Appreciate it. Bye-bye.